Do you believe new federal funding will improve our healthcare crisis?
I don't think so. I think in BC, our healthcare crisis is due to how expensive it is to live here. So, unless housing becomes more affordable, doctors aren't going to want to live here because they're not making high enough wages to afford to live.
I actually do, because I'm originally from Alberta, and Ralph Klein started this years ago. And you know what? I truly believe if it makes the line shorter for people that are in need of special, assistance, whether it be knee, hip replacements and such, I actually believe it. I believe that it would be very beneficial.
Well, I think it'll improve a percentage of things. I don't know if it'll make 100% better, but any additional income that the federal government passes on to the provincial government for healthcare is good.
Well, if I look at history, it hasn't. Like I say, the government likes to throw money around and say they're doing this and that. I think a lot of times it ends up in the wrong people's pockets instead of the people that are doing the, working in the hospitals, the nurses and so forth. They're not seeing it.
I'm not sure it's gonna solve all the problems, right? Because if you think of labor shortages, like if you don't have enough nurses, it doesn't matter how much money you throw at the problem. You need to have a national sort of educational program alongside that, and to sort of incentivize people, hey, come to this profession and be part of, be a nurse or a doctor or anything like that. So it's a big challenge, I would say, and it's not just in Canada, but it's something that we need to think about.
I think it will require a lot of funding. It's in bad shape. As a patient with multiple conditions, I have yet to see improvement, and I struggle to be hopeful.
Only if it's implemented properly. So like you can dish out billions of dollars into anything, but unless you're actually willing to implement it properly. So for example, whatever the amount is, take 65% of it and give it towards staff that's going to be hired. So this way you increase the pool, and then the rest of the percentage you create places specifically for the long-term surgeries that are waiting, or the short terms that can take 10 minutes. So like I know a guy who's been waiting 18 months for surgery, and he's on medication that he can't stand. And he said, I'm still on the wait list because my surgery is not dire, I have to wait. So in that regards, it could have been fixed easily.
I think so. I think it can't be worse for it, that's for sure. So yeah, I believe it will help.
I agree. That's something is better than nothing, and I don't believe it's in as much a crisis as certain people would have you believe. It's not the best, but I don't believe it's in the crisis that certain politicians would have us believe, but it certainly has to be improved.
Healthcare will always eat up every dollar that you give to it, but I do believe that we've underfunded our health service for a while, and you might be able to hear I'm from the UK. The NHS has been brutally underfunded for many years, and it's got to the point where it's on the brink of collapse, and I really don't see that happen here, so I'm happy to see the extra funding.
We need to support the front line more. I think middle management and upper management are really top heavy. For example, I worked in healthcare, and I think it was 11 years before I had a raise. So yeah, people burn out. That's why I quit. Burnt out. That's why she left.
Yeah.
I'm speaking for you.
Yeah.
Yes. I work in healthcare, and often we just need more money to do the things that we need to do, and a lot of it comes down to resourcing.
I think so. I mean, the province has been asking for quite a bit more. They were provided a fair bit more. So the funding is part of the solution, I believe. Yeah. So too is good strategic, delivery from the provinces. It's not all about funding, but I think the funding that was offered is a useful step in the right direction.
I think it will vary by province. I'm from Nova Scotia, so there we also have a very major healthcare crisis. But I think should the provinces choose to invest that wisely and not try and undergo tactics that will try and undermine the public healthcare system, I think it could go very well. With Alberta, well, we'll see how that goes.
Not going to do any good, I don't think.
I'd like to see them increase the number of doctors here, definitely. Whether they use that funding for education, perhaps, I'm not sure.
Yes, I believe it will, but it's not the solution. It's not the solution to a system that is, stretched beyond what's reasonable, right?